resolved to save lives. Directorate of Public Health and Preventive Medicine, Government of Tamil Nadu, IIT Madras, Department of Medical Sciences, IIT Madras, and hence all of us are here on a Sunday morning for a wonderful session. I extend a cordial welcome to all the dignitaries who will join us on stage, and I request Dr. Rajan Ravichandran to lead them, Dr. T.S. Selva Vinayakam, Dr. Amit Shah, and Dr. Krishna Kumar of IIT. Shri Kamakoti, Director of IIT, is held up in another program and may join us later during the session. It's really heartening to see the physicians' army, the salt fight warriors, as I would describe them, who will be in the forefront for this cause and make the citizens of this nation healthy and reduce salt intake in a significant way in the coming years. We welcome all doctors
of Tamil Nadu, friends from the media, the faculty members from IIT, students from IIT, and all of you ladies.
A few announcements as we commence the program. Request all those seated inside the auditorium keep their mobiles on silent mode. Participants, please ensure that the water bottles that you are using are deposited in your own bags. As IIT, we cannot litter any plastic water bottles. We have limited time to cover a number of topics, and should you have any questions to any speaker, please write them in your notepad and send it to the volunteers. We will take those questions depending on availability of time. All registered got it. A special request to all the speakers to adhere to the time allotted so that we can manage the resources effectively for the day. Kindly cooperate. And now we move on to the grand inauguration. Please raise in your seats for Tamil Thai Vazhathu and Vande Mataram.
நீராறும் கடலுடுத்த நிலமடந்தை கெழிலொழுகும் சீராறும் வதனமென திகழ்பரத கண்டமிதில் தெக்கணமும் மது சிறந்த திராவிடனல் திருநாடும் தக்க சிறு பிறனுதலும் தரிதனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழனக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம் வியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே. வந்தே மாதரம் வந்தே மாதரம் சுஜலாம் சுபலாம் மலயஜ ஷீதலா சஸ்யஷ்யாமலாம் மாதரம் வந்தே மாதரம் शुभ्रज्योत्स्नां पुलकितयामिनीं फुल्लकुसुमितद्रुमदलशोभिनीं सुहासिनीं सुमधुरभाषिणीं सुखदां वरदां मातरं वन्दे मातरं वन्दे मातरम्.
Kindly be seated. Dr. Rajan Ravichandran, Chairman of Sapiens Health Foundation and visionary who embarked on this SART fight since 2010, has been in the forefront championing the cause with commitment and enthusiasm. Dr. Rajan Ravichandran, who thought much ahead of the time, championed this special program and took up a salt reduction march in 2010. And he has launched several awareness campaigns and held 2 seminars in the IIT campus at Chennai and IIT Mumbai, and through his sustained articles and lectures, appealed to health-conscious Indians to reduce salt. To him, it is nation first, and so, amidst all his commitments with nephrology, he continues his social work with passion and intensity. Spearheading this mass movement for reduced salt intake, another milestone event for Sapiens after our Silver Jubilee celebrations last year, Dr. R.C. will formally welcome the gathering and outline the need for all of us to jointly promote an Arogya Bharat. Over to Dr. R.C.
Dr. Selva Vinayagam, Director, Public Health and Preventive Medicine, Government of Tamil Nadu. Dr. Amit Shah, Director, Resolve to Save Lives Indian Operations. Professor Krishna Kumar from IIT, dear friends and colleagues. I am very happy to welcome you all for this unique conference. I don't think you would have heard of a conference on salt. Where is the need for this? Actually, the idea came to us last year. I don't know whether Amit Shah recalls. So we had the 25th anniversary celebration of our foundation. At that time also we launched some of the salt posters. We had Sri Venkaya Naduji and Sri Rajnikant as chief guests and Dr. Amit Shah also. Soon after the conference, he talked to me about the Low Salter organization that I run, the Low Salter group of doctors and non-medical people. So he was telling, why don't we harvest, make use of it, and have a conference. That's how this idea of having a conference on educating physicians or empowering physicians on salt health was born. Actually, today's paper, in today's leading paper, a leading cardiologist has spoken about heart and health, how to take care of the heart. There's no mention of salt at all. The same thing happened a few years back. One of my colleagues from Bombay sent me a cutting saying that there is a write-up about management of blood pressure without mentioning about salt. And if you see the medical books and textbooks, there is just a line, avoid high salt or reduce salt, that's all. What should be the salt requirement? Where is it available in the food? What is hidden salt? What are salt substitutes? How do we reduce salt? No, we are not aware. It's not regularly discussed. So that's the reason why we are having this.
The Resolve to Save Lives has been
Us for this conference. I should acknowledge both Dr. Amit Shah and Dr. Manika Sharma for this successful conference today. Of course, the backbone of conference is physicians. So physicians, how do we get, and that too especially on a Sunday. Sunday to get physicians is very difficult. We know we have organized programs, you get 10 people, 20 people, and then you have, fortunately, if you hold it in a medical college, you can fill up with students. But otherwise, it's a very challenging job. And this is where then Dr. Selva Vinayagam and his team, Dr. Nagarajan, have been helpful in helping us to get the primary health care physicians. These are a very important group. They are people who are in touch with people. They are physicians who are in touch with the ground reality. And not only that, they are very influential locally. Whatever they say has a lot of meaning. And many of the physicians are socially well connected, politically well connected. They are connected to food industry also. So we have to empower these physicians. And so our success of today's, whatever is going to be, is because of the Directorate of Public Health and Preventive Medicine. And Dr. Selva Vinayagam has been telling the commitment of the government in preventing non-communicable disease. To that extent that he said that the first topic we should start the conference on non-communicable disease, and Umesh Khanna would be talking on it. I welcome also the other speakers today from all over the country, Dr. Narsingan, Dr. Umesh Khanna, Dr. Bharat Shah, Dr. Sampath Kumar, Zamrud Patel, Dr. Edwin Fernando, Dr. Murugesan. They are all experts who would be delivering the lectures. Last but not the least, I should talk of Professor Krishna Kumar. My association with IIT has been for more than 27 years. So with Professor Krishna Kumar, we devised the first acute dialysis machine in 1997. And after that, there have been several successful projects. To mention the phosphate binder in chronic kidney disease, which is still being used. We patented the drug in 1998 or something like that. And we have had several other projects. And in 2017, we had the first Salt Fight Conference, where we got Professor McGregor of the WASH, World Action on Salt, Sugar and Health. He is the first foundation started in 2005 to educate people on salt. So the World Action on Salt and Health it was, which they added the word sugar additionally subsequent. It was started in 2005. And Professor McGregor, who founded it, gave this lecture here. And other people who participated were Soumya Swaminathan, who was then the Deputy Director of the World Health Organization, and Anita Makijani, who is from the Food Safety Standard Association, and Professor Muridharan from IIT, and of course, Professor Somasundaram from the Directorate of Public Health, Tamil Nadu government. So we had a very successful conference here, which was followed by another conference at IIT Mumbai also. So we have been looking back. Sapiens Health Foundation was started in the year 1997 as Balaji Medical Education Trust with the view to help patients with kidney disease on dialysis and kidney transplantation. What we realized subsequently was that prevention is definitely anywhere more effective rather than trying to help just patients, which is very expensive. So in 2005, we started the preventive program with the Japanese Professor Toma and Tanabe. Japanese people are the world leaders in prevention of kidney disease, especially IgA nephropathy. There it is mandatory to test the urine every year for every child in the school. So that's how they detect the disease early and take necessary action. After that, we have had other programs like having a website on diabetes and blood pressure, sugarbp.org, and every year we celebrate the World Kidney Day to educate people about kidney disease and the measures that they have to take in preventing it. So today's need, you know, I'm sure all of you are aware, the number one killer in the world is hypertension and its complications. And a single public health measure, cheap and effective, is salt reduction in the population. That's the reason we are having this conference today. I welcome you all again, once again, to take active part in the conference and, of course, take home messages. Thank you.
Thank you, Dr. Rajendra Ravichandran. We are delighted to release the first edition of the Guidance Manual for Physicians, and I request Dr. R.C. to present it to Dr. T. Selva Vinayakam, Dr. Amit Shah, and Dr. Krishna Kumar. Another important way of communicating is through messages. And of course, today we are in social media, catchy slogans, one-liners, and Dr. Rajan Ravichandran even initiated street plays to educate the common man on many health issues. Today, we are launching on this important occasion colorful and powerful posters which will be there. We have already provided the posters in the kit that has been given to each of the participants.
You can display in your clinic or wherever you have your practice. And I request Dr. Silva Vinayakam sir to release the posters. The very distinguished doctor and health administrator from the government of Tamil Nadu, joining hands with the program is indeed a significant accomplishment for Sapiens. From 1993, his career has been of invaluable service in many departments of the government, passionate, purposeful, with stellar commitment to make Tamil Nadu healthy. He has carved a niche for himself, bringing private-public partnership in health sector to usher benefits to all. What is striking about his illustrious journey as a professional is his adaptation to new approaches combined with his own innovative ideas to create a robust platform for best practices in preventive health. He contributes with his incisive articles in journals, shares his knowledge and experience through books. Dr. Silva Vinayakam leads from the front his team on handling natural disasters and providing immediate relief to several people who have been affected in various calamities, preventing epidemic, and his work during the corona period was appreciable. Having participated in several national and international conferences, his work has been one of those of invaluable support to the government of Tamil Nadu as a seasoned professional and agile administrator. We in Sapiens have seen him in action at the DPH conference and in the interactions with Dr. RC, his penchant for serving society. It's happy augury that Sri Silva brings the wealth of knowledge and as Vinayakam will remove obstacles for our grand fight in reducing SART. Sapiens collaborates with the Directorate of Public Health Government of Tamil Nadu on Uppai Kuraipom campaign. Over to Dr. T.S. Silva Vinayakam for his erudite speech.
Thank you very much. So good morning, respected Professor, they call it finally RC, I'll also call it RC, RC sir, Sundar, Amit Shah from Resolve to Save Life, Mr. Kumar, and my Deputy Director Sudhil Nagarajan, and all the medical officers from the primary care who were assembled here on a Sunday as mentioned by them, and all the experts who are going to give the lecture on that. I thank again RC for this opportunity to speak to you all on this. Maybe I'll start with a small congratulations to you and your team and the Sapiens Health, sir. This biggest, what do you call it, is a major public health challenge or a developmental challenge, which usually a public health professionals will take care.
So you being a clinician, taking such a big lead and doing this as a public health strategy to control non-communicable diseases, much appreciated, sir. Thank you very much for taking a lead on this regard. We all know why we need to address this today. Maybe for the interest of the physicians from the primary care, we all know the non-communicable disease, which as per the global burden of disease, kills more than 75% of the population, almost 60% of the mortality, the complications, the challenges in Delhi are all because of this non-communicable disease. And if you need to address this non-communicable disease epidemic, definitely we need to touch upon those what we call as a risk factors. So particularly those risk factors which are modifiable. If we want to see those modifiable risk factors, these are your salt, sugar, and little more your trans fat. So unless and otherwise, which you need to address these factors, it will not be sustainable for even for any country to manage the complications due to NCD. So for example, our Edwin sir will know our hemodialysis is the highest utilized package in our CM insurance scheme. We spend more than 100 crores in a year for hemodialysis alone. Imagine the expenditure which involves and also the suffering that the individual has to go. So you need to visit the institution at least twice or thrice in a week to get this done. Even though it is available free of cost, imagine the person who need to take him to the institution, the sufferings he has to undergo. If we want to address these type of challenges, we need to control the hypertension. So if you want to control the hypertension, the most cost-effective public practicable intervention is the salt reduction. Maybe as pointed out by sir, இது ரொம்ப சின்ன விஷயம் அப்படின்னு நினைச்சிட்டு most of them will just ignore this. In fact, this is the most cost-effective public health intervention to bring down hypertension. See, there is already a global document and strategy. If you're able to reduce your current salt consumption by 30%, there will be a reduction of at least 25% prevalence in the hypertension. No cost, limited cost. But if you're able to practice it, definitely we bring down. But this is where this conference is going to address. See, everyone knows that we need to reduce the salt. But how exactly to implement it? This is where the role of the primary care physicians are there. See, unless and otherwise you learn, you practice, you empower the community, things may not happen. So there is already evidence. You need to translate this evidence so that the public can adopt. This is where the role of you, and definitely will do it, sir. And one thing which I like to mention is that it is no more a medical challenge. It is what we called as a commercial determinant. See, previously when you used to be a student, we usually talk about agent, host, environment. So the interaction of disease causing a disease. But now it's a more of a commercial determinants is having this problem. See, what is happening is because of industrialization and other things, the consumption of the process to put this is increasing. Because of our lifestyle modifications, things are changing. We instantly get attracted to the instant foods, the fast foods. But what is happening is that there is ultimately a overproduction, overconsumption, leading to all the complications, premature mortality. Again, the industry is searching for a new customer to the children. See, this is a big cycle. We need to break it at different level to bring down this NCD problem, particularly when you have more ultra high density products which is available. The children are easily get addicted to it. Both salt and sugar are addictive and it's very difficult to get off it. And because of the quantum which they take and also the easy availability of the ultra processed food when compared to your fruits and vegetables, it's easy for them to get adopted. Very convenient for them to use it. And for the parents also, this become an easy way of providing, satisfying the kid. This is where the big industrial, corporate, commercial determinants having a big role in the health. This we need to address only through people like you, we can do. So what is ultimately needed is your lifestyle modification. So even in Tamil Nadu, where we have a non-communicable disease, there's a separate program, Makkalai Thedi Maruthuvam, where we deliver the individualized drug package to the individual. Maybe right now we have more than 75 lakh hypertensive in Tamil Nadu and almost around 25 to 30 lakhs both hypertensive and diabetes combined together. See, addressing this 1 crore population who are already suffering is a big challenge. But we need to address it. We need to prevent the emergence of complications. At the same time, we need to prevent this further emergence. See, unless and otherwise we intervene, this will be a bigger problem which will be economically difficult to manage also. But what is needed is that, but how exactly do it? The recommended alvans. Say 5 gram, 2 gram sodium, this is all known, but practically it is very difficult to practice by each and every one of us, including me. See, the nutritional facts are displayed, but we never read. Even if you read, you will not understand what exactly it means comparing with the servings which we take. Idukku
talk about is that a common man who can understand the front packaging label, whether to take.
This is where the problem, where most of the countries are already adopted either voluntarily or mandatorily, but unfortunately in India, we are still only talking about good manufacturing practices. It's a time we need to move little more forward so that we can talk about how much salt we consume. See, the data, current data says that most of the time, almost 70 to 80% of the salt which we consume is from the hidden source. It is not the salt which we add, but it is the salt which comes along with the food we eat. Now, the eating out regularly, going out regularly, ordering the foods all become very easy. We get the enemy into us and things are happening. And another big challenge which we need to do is that there should be certain level of action which we as an individual can do it, and certain actions which we need to do it at a population level or community level. A government-led interactions also needed, which we'll address. At individual level, what I usually say is that let us be a mindful eating. So let us see what exactly you are eating, how much salt you are eating. Only we can start seeing it. So you look for an alternative with a low salt. Nothing wrong in to start with adding little regular food and a little lesser salted food. But the thing is that we have a very good adaptability. Our taste buds will get adopted very quickly. After that, it will become very easy for you to get adapted to the low salt. So this experience is already with most of our diabetics, where they used to adopt for sugar illada coffee tea. The similar way, this also can be done. But again, there are many things which we need to do it. Alternative pakla. Our RC sir will always talk about your adding extra salt, the salt shakers. Ning weekly the kudula salt podu or even when you go to a restaurant, you can definitely putting this additional salt without consciously. As soon as you get your soup, you start adding a salt. See, this type of smaller intervention we can do it. And canned processed food or processed meat is another source of heavy salt. We need to reduce it. Home cooked food, again all these challenges are come. We can do it one by one, definitely handling this. And we need to understand that there are many commonly which we right now eat contains more than the required salt. Urgalende, puppetlerende, ungloda order pandra pizza, pasta, whatever it is, are having more salt. The problem is we don't know that it is having more salt. And how much daily recommended advance, we are just taking it with one packet of chips. See, this knowledge need to be there. There are many simpler ways to do it. One of the easiest way is that what our RC used called as a traffic signal. Number milligram to convert to salt into sodium and to millimoles, it will be difficult for common man to follow it up. The easy is that if it is green, let's take the required quantity. If it is beyond orange or red, it's better to avoid. See, if this type of common information, if you are able to do it, yes, we can able to achieve it. But it takes longer time. And this is where, in addition to the sharing the knowledge from the experts to the practicing physicians, this team should act as a pressure group or a nudge to change this. nudge to take this as a government policy. See, this is the easiest intervention once you're able to break through it. There are many countries who already adopted this as a mandatory. Now it is a time where we start talking about எவ்வளவு கொடுக்கிறோம், ஏன் குறைக்க கூடாது. See, once you start reducing it little bit over a period of time, definitely the same taste what we are right now getting it will continue to have it. But this process has to start somewhere. This is where the Sapiens Foundation or the other experts can act as a pressure group to nudge the industry as well as the government to get into the role. Another big challenge we face is that at least the brand number adukku. Now, in the name of local product favoritism, there are many unbranded, unlabeled, locally available vendors cooking, which we don't know what is the quantum of salt or even other trans fat or sugar which you're consuming. It's going to be the big challenge. Third is your restaurant. See, consciously, we can have a little more pressure saying that we can start reducing the quantum of salt. And also, as he fascinately used to say, don't keep your salt sprinkler on the table. If you really need it, let's ask for it. Otherwise, it becomes a common for everyone to adopt it, to use it. In fact, I used to say that whatever the intervention which we used to suggest for tobacco should happen to the salt. You know, this is equally a bigger challenge, and it's all industry-driven challenge. Unless and otherwise you have a bigger group, it's very difficult to do it. And finally, evidences. Now, global evidences are available. In fact, GIFINA has already developed, this is a global database for your nutrition and food action, already developed a scorecard for every country to measure whether you are on the progress to reach the level they intend. India already, we are one of the top 50 highest salt consuming countries. Tamil Nadu, we are also take more number of salt. It's more than 8 to 10 grams per day. This is very high. Many times, as I said earlier, it all hidden sources, we are not even aware of it. And another thing is that it's a most cost-effective intervention. As I said earlier, every dollar which you spend, the intervention, the money which you spend on intervention, will give not less than $12 as a returns. Usually talk only about the immunization, where the cost effectiveness is very high. The similar way, the cost effective intervention, salt reduction, simpler strategy, we need to have a focus, do it, definitely have a huge impact. The impact is on many fold. So one is that you are preventing the occurrence of an hypertension, preventing the occurrence of complications, and also once you have done this, there's a huge savings on the economic cost involved in treating this. There are threefold interest: reducing the mortality, reducing the complication, prolonging your happy life extended years, and cost saving. These all can be done. And now there are current evidences which I came to know that if you are able to reduce your salt and if you are able to give little more ACE inhibitors, there is a possibility of medulla densa regenerating your tissues, kidney tissues. This says that the effect of the low salt diet or the low salt which you take, it will have a huge thing. And finally, it's our duty. So having known this knowledge, we need to prevent the public who are unaware of many things, protect them from this unhealthy diet, unhealthy healthy habits, including the salt, where we'll all resolve to fight together. And definitely, unless and otherwise we intervene right now, the big NCD epidemic cannot be prevented. Thank you very much for the Sapiens team to take this lead. Sir, thank you very much for the opportunity.
Amidst all his preoccupation, handling a very important portfolio in the government, we thank Dr. T.S. Selvavinayakam for his presence and wonderful points that he has made as a part of his inaugural address. I request Dr. Rajan Ravichandran to honor him as a token of appreciation with a memento and a book. Please give a big hand to Dr. T.S. Selvavinayakam. He is at home with us. Dr. Amit Shah, as influential as his namesake in the government of India, he is here with us and raised many an eyebrow when he was part of our Silver Jubilee celebrations in 2023. And the bonding began. Impressed by Sapiens' resolve to fight high intake of salt, Amit Shah, as the executive director of Resolve to Save Lives, started this dialogue along with his colleague Dr. Manika.
The experience of Dr. Amit Shah for 2 decades in public health
International NGOs and academia will bring a new dimension to stimulate our thoughts and give an impetus to our efforts on reducing salt. His rich and varied academic qualification that ranges from MBBS to Masters in Health Policy from London School of Economics and experience in USAID as its deputy director will help this public movement. We are hopeful that through him and his team, this campaign will have strategic inputs and support from the policymakers to make our salt fight effective. Looking forward to an insightful address from Dr. Amit Shah. We welcome him for his address.
Good morning all, dignitaries on the dais and dignitaries of the dais. So first of all, I would like to start off by congratulating Dr. Rajan sir and his team at Sapiens Foundation for organizing this workshop on a very, very important topic. I'm also thankful, sir, for giving me the opportunity to share my thoughts and inviting me and my colleague Dr. Manika Sharma, who leads our entire salt reduction portfolio. So, and I'm very mindful of Sundarji's request also for strict time management. So I assure you I won't take more than 5 minutes. So in the next 5 minutes, I'll just talk briefly about who we are, what we do, and why this workshop over here is so very important for us. So Resolve to Save Lives is a global not-for-profit. We are headquartered out of New York, and we have country offices in India, Nigeria, China, and Ethiopia. India remains one of our largest portfolio. We started our journey around 7 years back, and we were set up by Dr. Tom Frieden, a global health, public health leader, who also served as the director of Center for Disease Control in Atlanta, and who had actually overseen the entire global Ebola response. So when he started it off, there were 2 issues that we identified to work on. The first one was cardiovascular health, very much a neglected area, and as Dr. Selvavinayakam mentioned, if you look at the global burden of disease, NCDs, and within NCDs also it was cardiovascular disease. The second one was prevent epidemic. So these were 2 areas that we identified. But then how do we work and how do we move forward? So recently one of our global board members mentioned that within 7 years, we have been really able to achieve disproportionate impact for an organization of our size, scale, and funding. And the reason for that is partnership. The reason for that is we were set up as a global partnership, and we work in partnership with local government, with academia, with civil society, with healthcare providers. And that is our real mantra for success. Now, the challenge that we have set for ourselves is a huge, ambitious goal. How do you save 100 million lives from cardiovascular disease?
identify 3 strategy. First is how do you ensure that we are able to
hypertension control rates, which are averaging around 12-14% up to 50%. How do you ensure that we're able to reduce the dietary salt intake by 30%? And how do you ensure that we eliminate the harmful trans fat from the food supplies? So these are the 3-pronged strategies that we identified for our cardiovascular health. Now, if you look at the disease burden, it's staggering. Globally, hypertension accounts for more than 10 million deaths annually. It's combined than all the infectious diseases put together. This is much bigger burden than what the COVID pandemic was there in front of us. If you look at India itself, we are having an estimated prevalence of around more than 200 million people suffering from hypertension. Sir, I was wondering if at the registration counter we would have just kept a BP monitor or a blood diabetes. We would have realized at least 1/3 of this audience itself would have been hypertensive and diabetic. Now, against all of that, in India, in the last 7 years, we have been
On the hypertension control front, we were partners to work on with the government.
Organization and Indian Council of Medical Research to launch the Indian Hypertension Control Initiative. 7 years back, no one was talking about hypertension. Now that has become a national priority now. As we speak, there are more than 9 million patients of hypertension diabetes on treatment as part of that initiative, which has spread across the country. It's even there in Tamil Nadu to more than 150 plus districts. Now this has been taken over by the National Program for Non-Communicable Disease by the Ministry of Health and Family Welfare. On the TransFat, we worked with a range of partners to work with FSSAI, and India became one of the few countries in the region which has now got a policy for trans fat elimination. Now it is taking it to the next level of looking at implementation. Now sodium reduction is the tough nut, and really the toughest nut to crack, as my colleague always keeps on mentioning. So we know that excessive intake of salt is a key risk factor. We know that salt reduction is so very important for hypertension prevention and management. It ends into a vicious cycle. We have heart disease and we have chronic kidney disease and we have strokes. But at the same time, we know that we are twice of the recommended levels is what our dietary intake is. So how do we achieve that? Now, over the last several years, we have been working on different initiatives. In the state of Karnataka, we are working on the midday meal school program to reduce the salt intake. We are working with a partner such as Public Health Foundation of India to look at salt substitutes such as LSS, low sodium salt, generate evidence in the Indian context. We are working on front of package labeling that Vinay sir spoke about. We are also looking at economic modeling to look at the impact of taxation on high fat, high salt, high sugar products. But it's a long journey and a very uphill task. What gave us a lot of confidence was, and which was very inspiring, was the Silver Jubilee function of the Salience Foundation, which was held last year. The way Rajan sir was able to mobilize a whole of society approach. There were politicians and celebrities and healthcare providers and the local community. All of them were part of this movement, so as to speak. So that gave us the confidence that if we are able to tap into the work that is already being done through the low salter group. So what is here being done over here in Chennai is just a start of a movement. It will now spread under Dr. Umesh Khanna's leadership also to Mumbai and Delhi and other parts of the country. We really are hopeful that this will show the way not only for Tamil Nadu but other parts of the country and also other parts also of the world, where this can serve as a positive model, where we can mobilize the healthcare providers as agents of change. Because one of our very critical research findings that we had found out was healthcare providers are considered as one of the most trusted source of information, and their role is very critical if we have to achieve the goals of salt reduction. And we are very fortunate, sir, that Vinay sir, you are over here, because we have realized that no scale and impact can come without the government. And your partnership is going to be so very critical. What we are doing over here with private providers can definitely be taken over by the government in the Tamil Nadu health system also. Recently, sir, at one of the events that we had organized on salt reduction, we had the Director General of NCD, Dr. Swasti Charan sir, who was there. And he was saying that after looking at all of that, the audience and the discussions and all, he said, it's like the tap is open, we are mopping the floor. So till the time we work on the modifiable risk factors, it's really the burden of NCDs is not going to be an easy task for us. I would just like to end with one data point. By the time, sir, we finish off this workshop, in the next 4 to 6 hours, there will be 1,000 people who would have died across India because of cardiac disease, because of strokes, and because of chronic kidney disease. I think it's our moral obligation that we do everything possible in our hand to ensure that these lives are prevented. Thank you very much. Thanks. Thank you.
As was expected, he shared the importance of this collaboration between Resolve to Save Lives and Sapiens. On behalf of Sapiens Health Foundation, I request Dr. Rajan Ravichandran to present him with a bouquet and a book. Please give a big hand. as mentioned in my opening remarks, Dr. Kamakri is unable to join on time for this inaugural session. And we have one of our most ardent supporters, a pillar of support, I must say, Dr. Krishna Kumar, who has taken several initiatives along with us to support our several programs and has been closely networking with us at various points of time. And his data analysis, his research, sharing of information have been invaluable. And we know the type of support that IIT gave when Dr. RC was prescribing indomethacin as a special medicine during Corona. The support that Krishna Kumar gives and has been giving, including this, the arrangements for this function, deserves a big cheer from all of us, firstly. And we hope their support will be on a sustained basis to take forward several programs that Dr. RC is embarking related to health and as part of the Institute of Medical Sciences as well. I invite Dr. Krishna Kumar to share his thoughts.
Good morning. Thank you very much, Ms. Sundar, for a very nice introduction. So as I was walking in the morning at around 9 o'clock, Sundar came along with me with his mother. She's 80 plus and an ardent supporter of low salt. She's the VIP here, and I welcome you, Ma, for this conference. The other pillar for this whole thing is Mrs. Ravichandran. She's sitting right at the back, and I think that the support she gives for every program here has been invaluable. She's stickler to details, and I really appreciate her support. It's the people like her who are very important to this whole campaign. After all, the last mile connectivity is still held by people like her. It's no use telling all of us that we have to have low salt. Ultimately, it's people like her who actually make it happen. And the passion which she has shown, the passion which Madam has shown, something which is phenomenal. I just want to share one personal incident and then want to just tell you why we are here as I. So one day there was a concert, and I was just coming out of the concert. I felt very uncomfortable. I knew that there's something wrong. And I had a blood pressure unit at home and went and checked. My blood pressure was 180 by 90. I panicked. I immediately rushed to a cardiologist close by. And as I was driving, I was thinking, what's happened? My blood pressure is always under control. Why the hell did this happen? So suddenly I realized that instead of listening to Dr.
Officially call him Sashi, as listened to, as
she had asked us to take pistachio, and it so happened that my daughter brought pistachio from US, completely salted. So I've been taking this for 15 days, and I suddenly realized that that's the reason. And I told the doctor, he said, okay, wait for 24 hours. And I immediately called Dr. RC. He said, okay, wait for 24 hours. So my advice first thing is that don't listen to Kirti Suresh, listen to Dr. Ravichandran. He is the brand ambassador for us. Unfortunately, we are used to listening about the strength of cement, not from our civil engineering department, but from Shah Rukh Khan. Let's follow Dr. RC in this campaign. We are very interested to look at the science of low salt, or in other words, medical sciences and engineering technology department has been formed in order to give scientific support for things like this. We have Dr. Anubhava Rajan here, who's a researcher who's working on dopamine receptors in early detection of salt sensitivity. IIT Madras recently formed this Department of Medical Sciences in order to bridge the gap between the scientists and engineers on one side and the clinicians on the other side. In fact, Dr. Rajan Ravichandran is a professor of practice in this institute, and so he actually belongs to our institute. Though it looks as if he is a visitor here, no, he is a professor here. So we're very proud of Dr. Ravichandran being a professor in this department. So we work on science. In fact, the low salt campaign has to cover a variety of people, right from people who cook food for us and who take care of our health. Still in India, it's the women folk to whom we are indebted for keeping our health intact, to the hoteliers, as doctor was telling, to so many others, plus scientists, because ultimately there are doctors here, and you're not going to believe unless there is data, there is science in it. And Department of Medical Sciences and Technology is very keen to provide that science, that background that's required to carry this message. After all, ultimately, it is those few doctors whom we meet are the ones who are going to tell us what to eat, and it's better that we follow. The science, in order to reach them, we are very keen that we give that science. So that's how Department of Medical Sciences is involved in this campaign. This department has a large research base in various areas, and we have probably one of the best equipped laboratories in this country.
Programs. A lot of doctors, in fact.
You came in, Dr. Joseph and Dr. Arjun, who are doctors, who are MDs, who are doing PhD in our department. So we are doing work with doctors, or we are looking at physician scientists who would carry forward such things to a common man with scientific basis. We have a BS program, highly successful BS program in medical sciences and engineering, where 1 in 100 get a seat. So we have, for 30 seats, more than 3,000 people applied last year, and we expect this number to go to 6,000. So I'm very happy that IIT Madras took this step in order to form this Medical Science and Technology department. I know when we started this program, and at morning at 9 o'clock, I went to the gate, tell them that people who come here might not have visited IIT Madras, because many engineers know IIT Madras. So I had to tell them the route, where it is being held, and so on. Because I know many of you, as clinicians and with a medical degree, might not have entered IIT Madras. I welcome you. You have a lot of things here. And in fact, I welcome all the doctors who are here to the Medical Sciences and Engineering Department, because and Technology Department, because we have a lot more to do with you in order to take this campaign to scientists and medical practitioners. I don't want to take more time because already people are waiting outside to meet us. Thank you very much. Thanks for giving me an opportunity.
Thank you, Professor Krishna Kumar, for touching upon the importance of other stakeholders who have an important role to play in this campaign. I request Dr. Rajan Ravichandran to present him as a token of our appreciation and gratitude for all his support, a bouquet and a book. That was the formal inaugural session. I thank the eminent guests on stage for their time and words of encouragement. In a couple of minutes, we will set the tone for the technical sessions. I would invite Dr. Umesh Khanna to join us on stage for the technical session. சென்டர்ல. அதெல்லாம் இருக்கு.